Good evening. Thank you for joining us. I'm Yoon Jung-min. Starting today, medical professors at one of Korea's major hospitals began an indefinite walkout, just a day ahead of a walkout organized by the nation's largest doctors group. As the standoff between the government and doctors worsens, patients cannot help but worry. Our Kim Bo-kyoung starts our coverage.
Concerns over disruptions in the country's medical system are worsening after professors of medicine at one of the so-called Big Five major hospitals here began an indefinite walkout on Monday.
Medical professors at hospitals affiliated with Seoul National University have launched an indefinite walkout. A total of 529 professors at 4 hospitals are reportedly going to join the collective action. This is about 55% of the total.
Essential care, including emergency rooms, intensive care units, and delivery rooms, will continue to operate. But with professors from all 20 clinical departments at the hospital joining the walkout, outpatient treatments and surgeries have inevitably been affected, being reduced by around 40%. While saying the collapse of the medical system has already begun, the SNU's emergency committee demanded the government to fully scrap all administrative orders issued against trainee doctors who walked off their jobs in February. It also added it would be willing to end the walkout and engage in dialogue, but only if the government readjusts the new medical school quota for next year. Amid the prolonged medical standoff, patients have to be worried.
I have a cyst on my gallbladder, and this could develop into cancer. Later on, if the size has turned out to have increased, I would have to have surgery, but I'm worried I won't be able to get it.
I have come for dialysis, and I'm worried it could be halted.
The professors' walkout comes one day before a nationwide strike of community doctors slated for Tuesday, organized by the country's biggest doctors group, the Korean Medical Association. The collective action is expected to expand, as medical professors at 3 hospitals affiliated with Yonsei University also plan to halt most services beginning June 27. Though the doctors' pressure is getting stronger, the government is still firm on the issue. President Yoon urged officials to thoroughly prepare emergency measures to cope with the collective action, calling it an illegal rejection of their work duties. The government previously urged hospitals to request a review of their compensation claims if they suffer losses due to the prolonged crisis. Kim Bo-kyoung, Arirang News.